Hi, everyone, and welcome to our webinar today. My name is Rebecca Penn. I am the manager of the Substance Use Health Network, and I'm joining you today from Sokamkika, Mackey, colonially known as Shelburne, Nova Scotia. This is the ancestral and ongoing unceded territory of the Mi'kmaq people. People are joining us today from all over Turtle Island, and we're all people who are living on treaty lands and ceded and unceded territories. Our team at Sun and our community of practice members include individuals and organizations from many nations, territories, and communities. We all work in a sector that seeks to address social and structural harms. In doing so, we must recognize that these harms are produced through colonial histories and through the institutions, policies, and ways of thinking that continue to shape our daily lives. Indigenous people, as well as African, Caribbean, and Black communities, are disproportionately harmed and criminalized by drug policies rooted in racism and colonialism. We commit to working in ways that challenge racist and colonial institutions and practices, repair harms, prevent future harms, and help build a more just, inclusive, and equitable future. I want to acknowledge the people with lived and living experience whose knowledge, leadership, advocacy, and care have shaped the work in profound ways. So much of what we know comes from communities organizing, resisting, and caring for themselves and each other. We're also here today under the shadow of immense loss. We honor the many community members, loved ones, friends, and family members who have died and been harmed through an ongoing crisis. And we hold in mind all those who are grieving, surviving, and continuing on the face of this loss. For those of you who don't know the Substance Use Health Network, I just want to tell you a few things about us really quickly. We are a knowledge exchange and capacity building initiative that grew from the National Safer Supply Community of Practice. Our network has over 2,000 people now from every province and territory and some other countries as well. And our membership are all kinds of different people, healthcare providers, social service workers, people with lived experience, policymakers, researchers, advocates, and so on. What we have in common is a shared commitment to expanding access to evidence-based continuum of substance use healthcare options and to advancing drug policy that's rooted in the rights and realities of people who use drugs. To find out more about us, you can check out our website. I also really want to give a big shout out to Reclaim Collective. They've been an incredible partner to the Substance Use Health Network and been instrumental in keeping Sun alive over the past year when we didn't have any funding. I'm really pleased to say we're fortunate to now receive funding support through a CHR team grant called Advancing HIV, STBBI Health Equity Through Substance Use Health, a pan-Canadian research network, knowledge translation, and capacity building network. Please stay tuned for more information about that grant and the work we're going to be doing. Yeah, you'll be hearing more about that soon. Very quickly, some housekeeping. We are recording this webinar. We have closed caption available for English. Unfortunately, we haven't been able to have this offered in with French translation at this time. If you have, we've got the chat going. I haven't looked at the chat yet. I'm really grateful to Tanya and Anjay keeping an eye on the chat for us, and they'll be popping some things in there. You can also use the chat to talk to other people who are here as well. Yeah, to everybody, right? And then we also have the Q&A box. The Q&A box is a place where you can put things that you want to bring up to the panelists that we have today. So we're going to have a discussion, and if you have questions and things like that, throw them in the Q&A so we don't lose track of them. I'm going to send out a survey after the webinar, and it's really helpful for us and for getting funding and all of that kind of stuff, but also for us to know how we're doing. So please do take the 2 minutes to fill out that survey afterwards. And again, big thanks, Tanya and Andre, for being here to help support us. It's a lot of work putting on a webinar, and I certainly couldn't do it on my own. So thank you both.
Thanks for having us.
All right, so there's 2 things I want to plug today. This is today we are having our 3rd webinar in what's become a series called What Happens When Care Gets Taken Away. Before we get into today's conversation, I want to promote the 4th webinar happening on July 22nd. We have Jeff Bardwell, who's a researcher, coming to talk about some work he's been doing, and he's going to be bringing some people from his community partners to that webinar as well. We're just figuring out who those folks are going to be. But yeah, come listen to this webinar. We're going to be talking about pleasure and overdose response and how important it is to about how people wake up, how people's overdoses are responded to. So yes, please come to that. You can find the registration either through that QR code on our website under upcoming events. And Andre's also put it in the chat for me. Thank you, Andre. You're quick with that. And we don't normally do this, but these are not ordinary times, right? I want to promote or share information about the Ontario Emergency Overdose Prevention Fund, which was recently launched by Catalyst and Philanthropy, and Andre, quick with the chat there, has put the link to find out more about this fund. You can click on that link yes, you can share information. We really are trying to fill the gaps that are being left by or that are being created by the loss of funding. And also, this fund is for Ontario organizations, but Ontario is not alone in looking for funding to address the desperate needs that organizations are trying to meet. So if anybody knows of other opportunities to support organizations in other parts of the country, can you please put those in the chat? You can also email them to me. And I'll include those when we put everything up on our website afterwards. Okay, so over the past few months, like I say, we've been having this webinar series, What Happens When Care Gets Taken Away? And this came about because a number of researchers contacted me saying that they had study findings, evaluation findings and such to share about the impact of loss of services. The first webinar we had was about the loss of funding for a safer supply program and what happened when that funding, what happened to the people who were on that program when the program suddenly ended because of funding being cut. And then the second had a number of different researchers who were sharing findings about we're trying to, let me try to speak here. They were sharing findings about SCS closures in Ontario. So a year ago, a number of the SCSs closed, and these researchers were following this and tracking what was happening. So we presented those findings. And, you know, it's really important that we have this data and research. The findings that they shared were distressing, but sadly not unexpected. And yeah, research can be powerful. It gathers evidence, identifies patterns, and helps share like a broad story. But today we're not going to look at numbers or at experiences distilled through a researcher's lens. Today, we get to hear from the people who know best about what happens in supervised consumption sites, what roles these services play in people's lives, and what it means when those sites are taken away. So we're really privileged. I'm so grateful to our panel today. We have a group of panelists from Alberta, Saskatchewan, and Ontario with us. And thank you all so much for being here with us today. Thank you for you taking time out of your day. And also really grateful for Zoe Dodd. Zoe, I'm going to pass it over to you. Zoe has been instrumental in making this webinar happen today. So really grateful to you, Zoe. All right, that's enough of me. Thank you, everybody. Zoe, go ahead.
Hi, thank you everyone for joining us. Like super excited that we are having this webinar today. It means a lot given the circumstances that we're under, but always as someone who's been working in this and addressing the toxic crisis for over a decade and being in harm reduction and as a drug user advocate for the last 20 years, it's always so important to listen to the voices of the people with lived experience, those who are using services, those who are losing services, those who are fighting for them, those who use drugs. I I just want to make that point because we have, it's great. We have a lot of researchers. I'm currently working as a community scholar at the MAP Center for Urban Health Solutions, but it will always be super important to make sure that we center those who actually have the experience of this of using drugs or accessing supervised consumption sites. Sorry, I got distracted there for a second in my thoughts. It's been unbelievable disaster what's happening across this country, especially in our provinces. And so I'm just going to read a little backgrounder and just really, really fortunate and glad that so many people have joined us today and that the folks who are on this webinar with us have agreed to be here. I'm really looking forward to what they have to say. Um, so, across the country, we are seeing a rise in toxic drug emergencies and harms and deaths. And despite the 10-year crisis, we still lack coordinated tables, the ability to address this crisis without political and ideological interference. So that has been a challenge no matter where you live. Like Toronto, for instance, the biggest city in the country, has never had a coordinated table with all emergency services, libraries, like shelters and housing, everything coming together. There's always been a refusal from public health, from the CMOH's office to create such a table. In recent weeks, the new CMOH for Toronto said to people that, well, it's an emergency that will never end. It will never end, so we can't call it an emergency, which is quite frankly, so upset. Furthermore, we have decade needle exchange programs, which have all been under attack. And people are playing politics with people's lives. They're punching down instead of punching up while more and more people suffer, are harmed, and die. And I think, we've seen this for many years now, these attacks. And it's not people who have to live it. They're not living these experiences. It's very outsiderish. So the drugs treatment system has remained fairly stagnant at this point, hasn't changed to truly meet the needs of people using synthetic drugs. And we're talking about from pharmacotherapy like Suboxone and Methadone to residential rehabs and detox. In Ontario, where I live, access to other sources of care remains out of reach for most people who do not have the means to pay for the private system, and people still hubs will deliver. Heart hubs are abstinence-based. They do not connect people to like new services. Were not piloted with evidence, did not include experts in their creation. They're political intervention. Ontario, Alberta, and Saskatchewan conservative governments not only work together, but have been closing life-saving supports and dismantling harm reduction. This politically motivated ideological campaign has had trickle-down effects and made it really difficult for other cities to open much-needed support. And currently, after a decrease in deaths last year, we are seeing a huge rise. We are also witnessing a rise in emergency calls, hospital visits, rates of HIV and Hep C increasing, people overdosing outside in public. Like since the closures here in Toronto, now we have like 3 sites left. We have just seen like people overdosing in all sorts of places outside and in places that are hidden. It's been absolutely devastating. And then those places that have closed, people see folks outside of those organizations, and instead of being able to respond inside, they're having to respond outside constantly. Currently, after a decrease in deaths last year, we're seeing that rise, and we're also witnessing a rise in emergency calls. So in the first 5 months of 2026, calls for suspected toxic drug emergencies in Ontario increased by 20%. In Thunder Bay, and in Thunder Bay, 20%, 199% in Hamilton from January to May compared to the same period last year. Non-fatal opioid overdose calls rose to almost 115% in Toronto. And Ottawa Paramedic Services recorded a 52% increase in overdose calls, including incidents not related to opioids. In Saskatoon in May, firefighters responded to 537 overdoses in Saskatoon alone. That's on track to far surpass last year's 2,512 calls. Closing prairie harm reduction made the situation catastrophic. We're talking about a city just over 300,000 people. Lethbridge and Calgary were forced to close their sites, and Ontario has 4 sites left, all privately funded after the closure of 17 and all the ones in the shelter system. Decades of austerity, a housing and unaffordability crisis, climate change, attacks on Indigenous sovereignty, the war on drugs, privatization, colonization all overlap to create this deadly emergency that we are in. Silence from our Chief Medical Officer of Health and coroners demonstrate the need for public appointments, not political appointments, where these public servants are there on behalf of us and are not gagged. The recent attacks, the defunding of and closing down of essential emergency services that are lifelines for so many, many people cost lives. The fight to save them left on the shoulders of those who already bear the brunt of this emergency, where new cocktails of synthetic drugs are more dangerous than ever before. Ramping up the war, the drug war, and busting drug traffickers has not changed for the illicit drug supply for the better or people's access to it. It's actually just gotten worse. So when we fought for overdose prevention sites and supervised consumption services, we saw this as one part of a fight to end the toxic drug crisis and respond to this emergency. They are not a silver bullet and never were intended to be, and they were not going to solve the housing crisis or the drug trade. They were and are there to support people. Today, we are extremely fortunate to have a dialogue with these amazing experts who have the lived experience of surviving the toxic drug crisis and using supervised consumption services, and they are the real experts. So please give them a warm welcome. And we're going to start with introductions of each individual who's here and where they're from. And so I'm going to hand it off to Travis, who is talking to us, I'm pretty sure from Lethbridge, but maybe I'm wrong.
Hi, everybody. How are you today? Yeah, I'm in Lethbridge. My name's Travis. I'm 41. I'm currently living in Lethbridge, and I grew up in Calgary. Yeah, so I'll just jump right into it. I'll talk a little bit about what led me to the safe consumption sites and opiates and where I am now, and I'll try and sum it up as cleanly as possible. So I was raised in Calgary, and I was my parents were young, and I was raised in mental, emotional, and physical abuse. I struggled, and my parents struggled with. I had severe ADHD. So that was probably my first experience with drugs, and a core value that it wasn't okay to be myself. Like, my parents would hold me down before school and shove Ritalin down my throat. And fast forward till I'm about 11 or 12, and I find alcohol and drugs at a pretty early age, and I now know today that what those alcohol and drugs did for me was teach me how to cope with feelings that I didn't know how to deal with, and I carried that through my whole life. I was a cocaine addict for my whole life, and that's exactly what cocaine did for me. It kept me from feeling all the horrible feelings that I just didn't know how to deal with: trauma, grief, loss, abandonment. And if I was high, I didn't think about any of that stuff. So Zoe touched on it, long sentences for drug traffickers. So in 2014-15, I was sentenced to 6 years for trafficking, which is significantly more time than people get for manslaughter or rape. You know what I mean? It was my first prison sentence. It was long, and it was my first experience with opiates as well. So I did Suboxone daily in there for 3 years, and when I get out, I'm sick, right? And the opioid crisis also happened when I was inside. There was no fentanyl before I went in. There was no meth. It was mostly just cocaine, right? And so I had never done any of those drugs. And I go out on parole and I'm sick, and it's my first experience with fentanyl. I go right back into prison right away, and they detain me until my last day. So I get out in 2021, addicted to opiates. And somebody brought me street source fentanyl, and um, that's my first experience with the safe injection site, because I also don't know how to do anything half. And I overdose every day. This puts me at a point where I used for 6 months coming out of prison fentanyl, daily at the site in Calgary and in Lethbridge. That is where I got the information to go to detox and treatment, and where I felt safe and respected and loved enough to start having those conversations that led me to recovery in the first place. So from 2021, I made it almost 4 years sober, and this is a big part of my story, because addiction is insidious. It takes diligent work every single day to stay sober, and insidious as in it lies in wait to cause great harm. I went through some relationship problems. Me and my partner ended up relapsing together, and my daughter was 2 at the time, and I couldn't stop. One day I come home and the house is empty. Right, my daughter's gone, my partner's gone, the cat's gone, the hamster's gone, and instantly I forget about all the supports that I have, which was a lot. I didn't reach out, and one day I think I'll never use again, and the next day I'm using. And within weeks, I needed those sites. I didn't know how to deal with the pain of being away from my daughter, being away from my family, and I coped the only way that I knew how, which was hard drugs. And so I end up I get attacked by a canine unit in October, and I'm in the hospital for the most of November and December, and using the safe injection sites every day, overdosing regularly, struggling to not even just not want to live, but even no love for myself at all. And the only place that I did get that love was from people in the harm reduction community, and the peer support workers at the safe injection site. And like I said, it was a safe place where I felt loved and respected to start having those conversations about missing my daughter, and how heartbreaking that was, and not wanting to live, and what I could do to make a change, which was to start reducing the drugs that I was doing, which were conversations that I had in that site, and to start taking care of the dog wound in my leg, which kept getting infected. The peer support workers at the Calgary site, I wouldn't have my leg today if it wasn't for them, let alone my life. They took care of my leg every single day. They cleaned it, they wrapped it. They knew I didn't want to go into the hospital, medical trauma, stigma. They took care of me at the safe injection site. They fed me, they clothed me, and most importantly, they loved me when I couldn't love myself. I still have relationships with those peer support workers today. Eternally grateful for what they did for me, because they allowed me to survive long enough to have recovery and to be a present, loving, gentle father. And today, that's my purpose and my drive. I have full custody of my 3-year-old daughter. We have a beautiful, beautiful, happy life. And I worry like that because of how quickly that relapse impacted me and my family's life last time. What happens if those sites aren't there? And I want every form of medical treatment available, because what I have is substance abuse disorder, and it's a lifelong chronic condition, and it can come out of nowhere. And I experienced that when I was just about 4 years sober. And though I hope I never need those sites ever again, I want them available, not just for me, but for everybody else, because everybody else is somebody's son, somebody's daughter, somebody's mom, somebody's dad. And thank you for allowing me the space to share my story. I appreciate you.
Oh my God, we appreciate you, Travis. Thank you for sharing that. I think this is truly why we wanted to host this panel today, is so that people hear these stories. It's and the struggle that people have, and I'm so glad you have your child and so glad that you're here sharing this with us today.
Thank you,
The
Penny.
next person I'm going to ask to speak is Sam. Yeah, and we're going to have more discussion. So we're introing and then we're going to have dialogue. So we'll hear more from everyone. The next person I'm going to ask to speak is Sam, also in.
Hi, my name is or Samantha Mackey. I live here in Lethbridge. Yeah, so forgive me, I have a little bit of anxiety today, but I've been a drug addict since I was 14 years old. My preferred drugs of choice was fentanyl, meth, and crack. And my preferred way of using was shooting up. For the past 10 years, I've had extreme psychosis and paranoia. And I've overdosed. I was overdosing almost every day. And I'm lucky enough to have survived because of the education that harm reduction provided to me and the sites that were available to me at the time. I was also blessed enough to, when I was a client here at Arches, I would go and pick up harm reduction stuff like needles. I'd go there when I was in psychosis. They were a harm reduction agency here, and they asked me to join the committee that was preparing to bring the site to Lethbridge. And I couldn't believe it because I couldn't see the value in myself at that time. I was kicked out of both shelters here. Nobody wanted me in their house. I was homeless, and the only place that would accept me was Arches. They're the only people that, didn't look down on me. Because at that point, all of these other resources here in Lethbridge that had helped me turned me away because things had gotten that bad. I was surprised, I could go to Arches, you know what I mean? And then when they asked me to do that, of course, I wanted to do that and give them everything that I could. I didn't believe in myself yet, but they did, and they didn't require me to sober up or anything, and it was the first thing I was finally good at that I could provide value to. And it changed my life. And so anyways, so yeah, we opened up the consumption site. I was a population expert on the committee, and then I was a peer support worker at Arches, the site here, busiest one in North America. Yeah, I worked there from open till close. And I was also a client there when I wasn't clocked in. And like I said, it changed my life. If I wanted to sober up, there was support. If I wasn't ready to sober up, there was support. There was support everywhere, and it wasn't about going there and picking up and using. It wasn't about that. It was about the wraparound services. We had something. We had this program where kids could come in, like not kids, sorry, our clients could come in and rap. We had a cultural room and people could smudge. It was amazing. We were 24 hours. We had about 600 to 700 people a day at the peak. And it was a beautiful thing. It was great. After it closed, I helped start a non-for-profit for an unregulated consumption tent in Lethbridge. We also did outreach and provided what we need to the community because we recognized obviously there was a massive hole in the community, and we didn't just want to leave our people like with nothing. It was a shock, I think, to everybody in our community. Like all of my friends, everybody that I knew. So yeah, so did that, and then since then, like I said, like because Arches gave me that opportunity, I've had a career in this, and it's been amazing. But yeah, my addiction has been extremely heavy and extremely dangerous. And if it wasn't for the knowledge that I've learned in harm reduction, I wouldn't be here. I was reckless. I was so reckless. I was dangerous to the point where I just remember at the worst point, there was other drug users that didn't even want to be around me, and that was rough. But the thing was with harm reduction, they were there to teach me how to do things safely and stuff, because there was no way I would be sober today if I was dead. You know what I mean? So to provide me that harm reduction and meet me where I was at was the biggest thing to get me to here. I've been clean off of drugs for uh, I think 15 or 17 months. I don't count. But yeah, I went to treatment in Edmonton at Poundmakers. And I'm just extremely grateful to be here. Me and my fiance, who's also sober for the same amount of time, we were out on the streets together. We have a new house. Our cats are happy. You know, we can afford the special food for our cats. You know, we can afford rent. We just bought an air conditioner, so it's great. I mean, life is good, but I wouldn't have it if it wasn't for harm reduction and the services here. We need this stuff back. And sorry, I rambled on. Thank you so much for having me.
Oh my God, thank you so much, Sam. Like, I don't think people, you're amazing. And I don't think people realize that, you know, when you say 600, 700 visits a day, that Lethbridge is a city of less than 100,000 people. We're talking about a small, it's a small city in Canada. And it was and is, well, was the busiest supervised consumption service because it also offered inhalation, which, you know,
Yeah.
we would all love to have expanded and still need to expand and to actually meet the needs of people. Thank you for sharing that. I love that you got an AC. It's very freaking hot. Um, I'm gonna move to Ashley in Saskatoon.
Hi, hi everybody. I'm Ashley Gray Eyes. I live here in Saskatoon. I worked at our safe consumption site, Prairie Harm Reduction, for a little over 5 years, I want to say. I started there during COVID. When I was a drug user, so I started with alcohol. I think I was like 10, and then I started smoking weed and then eventually just went on to harder drugs. I got sober when I got pregnant. I was 18. It was very short lived. I relapsed when my son was only a couple months old. Yeah, so basically, since I was like 10 years old, I've been an addict. I've been struggling. I got clean in 2017, relapsed 2 years later, relapsed again a year later. And then I was sober for 6 years. And I thought, like, this is it. I'm sober for life. That's not the way addiction works, unfortunately. I recently relapsed in April, but am 2.5 months sober now. Our safe consumption site closed just in April of this year, and a lot of people are lost. Our people are lost. In April, there was 690 overdose calls to our emergency services. Our emergency services have been extremely overwhelmed since we closed. We were not as busy as Lethbridge, but almost as busy. We served anywhere from 300 to 700 people a day. And we also had like the wraparound services. We had case managers. We had like I myself am an addictions counselor. The safe consumption site was super important in my life. I would go there just to test my drugs. I was always really afraid of fentanyl. I was always paranoid. There's fentanyl in everything. So I would test my drugs often, make sure, you know, it is what I was buying, what they were selling, and definitely drug testing was huge. We had an overdose crisis last year in 2025. There was a very toxic supply, and we lost more people that summer than I had lost during my entire time working at the safe consumption site. Yeah, I'm just thankful for the safe consumption site because I do believe that I would not be here. I was at the end of my addiction, I was just using anything and everything. Didn't care. The spike in deaths, definitely the toxic drug supply. Um, there was an incident here in Saskatchewan where a bunch of heavy, heavy tranks. I don't even know the names of them, but there was xylazine in there, methamphetamine, and some other things, and it went missing off of this waste disposal truck. And then we were finding it in all the drug testing that we were doing. So somehow it went missing and ended up on the streets, and it was deadly. It was There was people who were 20 years into their fentanyl addiction, and then they're overdosing from what they thought was fentanyl. I feel I'm rambling. Maybe we can just move on.
Yeah, sure. But thank you for sharing that, Ash. Like, I think a lot of people on this webinar understand the devastation that is occurring and has occurred. And I think I often think of this, and we could talk about this later, just how this crisis bring like for many people who start using a lot has to do with like loss and death, and how loss and death brings more loss and death, and ways in which people used to cope. And it's not something we talk a lot about. And so when we have that much loss in community, just how hard it is for people to keep going. And maybe we'll talk about that a bit more later. This is going to be a heavy webinar, so those who are on, I'm really appreciate you being here, and for everyone speaking so far. So thank you, Ashley. I'm going to move to Akosua here in Toronto.
Thanks. Hi, my name is Akosua. I am here in Toronto. I came from British Columbia. I was raised in British Columbia, in a very small podunk town called Mission, BC. And I came to Toronto when my father moved to Africa, and I didn't want to move to Africa. So I moved to Toronto with a friend, but I was not prepared for Toronto as a young, stupid girl thinking that the world is your friend and everyone here is your friend. So I was put into survival sex work immediately. And it brought on drug use, heavy drug use immediately as well after that. I had my first son, and was fine for a while until me and his father weren't together anymore. And then it became survival again. So I went back to doing what I knew would make the money that I needed to take care of my son. In that came the parties, came the drugs, came the crap again. So after that, I made the decision to give my son to his father, who has never used drugs and wasn't that. So I made the decision to give it to him. And at that point, I moved myself to downtown Toronto, Sherbourne and Dundas area. At that point, it was survival sex work on the streets. It was intravenous drug use of fentanyl, smoking crack, whatever I could get my hands on to make myself feel better about the decisions I made to not be the mother that I thought I should have been. As well, coming from, a childhood where my mother also left me and went back to doing drugs, like that generational trauma almost kept going until, I came to downtown Toronto, was introduced to Moss Park at that point. And I'm telling you, if that wasn't the case and I didn't meet the people that I did who brought me to that space, things could have went extremely bad for me as a Black woman navigating sex work and using drugs in front of, like, as a Black person, lots of us do not let people know that you're doing that. You keep it to yourself, you die by yourself, you don't educate yourself, you just are ashamed. So again, the sites gave me the opportunity to meet my drug counselor, who, once I met my husband now, we all came together, and I came to the decision that I don't want to live like this anymore. I don't want to be this person anymore. Which, nobody wants to live the life that we've lived. Like, no, we are there because we didn't have the things that we needed and the trauma that was caused. And then we found the things that made us feel a little bit better, but then it was good in the starting and it went down really fast. I was not one to overdose all the time, but I was one to have to respond to others outside of the site, which was also traumatic in trying to keep people alive outside of the site, right? It fell into the hands of the other people doing drugs in the room, to look over and see that, Paul is blue at this point and we should probably do something, right? Which is now going to be the reality of a lot of people and a lot of, normal people walking around with your children and your this and your that. So I just wanted to come on and say that this has given me the opportunity. Harm reduction has given me the opportunity. The safe injection sites around Toronto have given me the opportunity to do survival sex work safely, to have people looking out for me and making sure, oh, have we seen Akosua today? Have we seen Akosua yesterday? Has anybody seen Akosua? I knew I had people looking out for me. When I would make large amounts of money, I was able to bring it to Moss Park, sign a paper, and they would put it in a locker for me. And I could come back and take it as I please because I have nowhere to live. And it's dangerous out there for women, very dangerous out there for women. And people doing sex work, very dangerous. I am now a housing stability case manager for the shelter that I used to live at in downtown Toronto, but I would never have been able to get to this point if my drug counselor, who I've known from Moss Park, who sat there and made sure I slept and nobody touched me. She sat next to me on the couch and let me sleep, knowing I had been up all night trying to survive. She let me sleep. Like, she is the one who saw my potential, stayed with me through my crap, through my childish crap, and then also was like, this is what you can do. I did it. I went through school. I had my second son. I am now 9 months into my job of supporting women to see the potential in themselves. And I would never be here today if it was not for harm reduction, if it was not for the safe injection sites. And I really hope that politicians understand when your children and the trauma you cause them do drugs, you are going to hope those things are available for them. And when they're not, God help you. Thank you.
Oh, thank you so much, Akosua. I think it's so important when you talk about what it's like for Black people. Moss Park is a neighborhood, for people who don't know, in Toronto. It's has a large Black population. There are a lot of Black people who use drugs. There are a lot of Black people who are homeless. And oftentimes within, like, when we're talking about supervised consumption site, or we're talking about, the toxic crisis, we're not talking about Black people's experiences. So I really appreciate you sharing that. I think that's important for people to understand. Racism and the war on drugs is a big part of it. And the war on drugs, we don't just talk about it being about racial and social control as just these buzzwords. It's just really how these laws have always been, and who is the most affected by them, and who is the most targeted by them. I'm going to move to Ali um, and then Jonathan. I just also want to say, I know that Akosua, you're going to be traveling as you are on this, so you'll just have to listen in as we keep moving on
Thank
through.
you.
Okay, thanks. Okay, so I think Jonathan was first, right? Yeah.
Yes. Hi. Hi. My name is Jonathan. I was born and raised here down in downtown Toronto. Um, so I've always had a history of drugs in my family. I've seen a lot of stuff growing up, but probably most kids shouldn't have seen. And eventually, I started testing out different kind of drugs and stuff like that. I guess what happened was I had my son when I was 20 years old, and I was working roofing at the time, and I fell off the roof and I got injured, and I was started to get prescribed oxycontins. That's I would say where my addiction really took off, from the oxycontins, and then I started partying, using cocaine and different other substances, and started pissing dirty for the doctor, and he cut me off my supply for oxycontins. And right from there, I graduated to heroin and other drugs, right, that were a little more stuff that, I wasn't really used to or anything like that. And, it was, I lost my house, lost my son. Things started to happen very quickly and randomly. And, the progression of the drugs just took off from there. Um, until I ended up downtown in the Moss Park area. And, it was around the time where it was the change from heroin to fentanyl. So, I mean, it was crazy down there in Toronto and Moss Park during those times. Like, they had the tents and stuff set up in the park, and thank God that these people were there for us and the safe consumption site, because like really I had nobody out there at this time, and I was at my lowest of lows, and really didn't feel like living anymore, and just living every day, getting high, just to waiting to die basically, because I was so lost in a dark space at the time. But you know, being with these people at the sites, and where we had the tent set up, I actually started to, you know, there was so much community in the streets. Everybody's looking out for everybody. Like Akosua was just saying, everybody would ask, "Hey, have you seen Jonathan today? Have you seen this person, that person today?" And really made us felt like, we still had purpose in the world. So naturally for myself, I started hanging around the sites and started picking up things, because the people that I worked with at the sites, they were just so nice, and I just felt this over gratitude feeling of hope, and that like people helping other people at their lowest of times. It was just great to see out there. These sites did so much for me, and I just, what's going on today is totally, it's sad. It's really sad to see what's going on out there today. We've lost so many friends, family members. I can go on forever, really, but yeah, it's really sad about what's going on. I'm glad to be here today and speak with all of you guys. Sorry, I'm a little bit nervous, and yeah. Thank you, guys.
Appreciate you so much. Yeah. Ali?
I'm also really, really nervous, so just bear with me. Yeah, my name's Ali. I used not just one site. I kind of went around to between like Moss Park, Fred Victor, the Works. I was kind of like back and forth, kind of like a ping pong ball between them all. Yeah, for me personally, my story, like I don't come from a place or have a story of like any trauma or drug use in my childhood and growing up or things like that. I had a pretty like normal family, whatever you want to call it. But then when I turned 17, I was in a relationship with a guy who, was like the bad boy and everything else. And I also experienced a lot of loss in my immediate family. My stepfather passed away from a workplace accident. He went to work on Valentine's Day of 2012, never came home. Then I think like maybe 4 months later, my grandfather died, who also lived with us. And, like I also have twin sisters that are 10 years younger than me. So I was 17 when my stepfather passed away. They were 7. Instantly changed the whole house, of course, like my mother and just the whole family dynamic. It was very, very hard on everybody, of course. And for me, I just didn't really know anything. I wasn't educated about drugs enough. Like I tried smoking weed and like the usual, maybe high school stuff, but it just wasn't really for me until I found heroin. And like for me, it was like I didn't like dibble dabble. Like for me, it was like I did heroin and like, wow, like this is what I wanted. This is like what I needed. Like, and right away, like the next morning, I was instantly sick. And I didn't even know that it was withdrawals or anything like that. I just thought I was like really sick. Like maybe I ate something bad. Like I was that like uneducated and naive about it. And I thought, oh, you know what? Like I'm just gonna go get some more, and I'll just like knock out, and then hopefully, like I'll just not be sick anymore. Then I start Googling all these things, and like, what does cocaine look like? What does heroin? So it was very like, oh my God, like this was pretty close to like what heroin looks like on Google, right? So now I'm like freaking out. And my boyfriend at the time was like, we need to go get on methadone, right? Because we both were like uneducated. So we go to methadone, and now I'm on methadone. And it's just like, I feel like just one decision in like 30 seconds changed my life in the direction it was going for like, I guess the next like 10 years. And in that time, like my ex partner had gone back to jail, and I guess was able to stop, or whatever his story may be. You know, we kind of parted ways, and for me, it just wasn't the case, right? Like I just continued on and continued on because I couldn't stop. Like, you know, even if I wanted to, like the withdrawals are so bad. My family was always there for me, still is, which I'm very grateful for. Me and Jonathan, we were a couple together when we were out there on the streets. And I'll never forget, like going for like routine blood work, like, you know, the doctor was like, you're pregnant. And I'm like, wow, like that's just not what I was expecting, obviously. Like we're here to like make sure that we're like okay, clean, like whatever, like, or we have clean blood work and everything. And I was like, okay. And right away, like, I'm just like, what do we do here? You know what I mean? Like, of course, I'm weighing my options because I know the situation that I'm in. And like my options are very limited at this point. And, you know, we're homeless, we're living on the streets. And, you know, who was there? The staff at the sites, right? Like, you know, they would walk me to like my appointments. They would make sure that I had something to eat, make sure I had gift cards, like, you know, like I don't even think like my daughter would be alive and okay, like had people not stepped in to do that. Because as much as I had the good intention and like I was given these appointments and this information, like I wouldn't have made it. Like when you're on you're just so different, like, you know, like I could have every good intention in the world, and that's just really not how it is, right? So if it wasn't for that, like, and making sure that I was connected with St. Mike's and like the special doctors at St. Mike's, and, you know, making sure I have like my appointment to get induced and go into, like, everything was put in place. And then of course my mother put us up in a hotel, especially towards the end, because she was just so scared that I'd go into labor like in some alleyway or something, which was very probable, right? Like, and it was like people at the site, you know, like who really, I could not stop using drugs when I was pregnant with my daughter, unfortunately. So she was born on drugs. As much as in my heart and my head I wanted to, like I couldn't. You know, thankfully I had these sites, like, and not only for that too, but even after I had my daughter, like, you know, the workers would walk me to like go visit my daughter in the hospital, or go, you know, have visits at the CAS office, or whatever the case may be, right? And not to mention too, like I had a lot towards the end of my using, like I've been in recovery for 4.5 years now, but towards the end, there was kind of like when stuff was coming in, there was getting like, I can't remember what, like the trank stuff, like people had mentioned, and I got a batch of that, and it had eaten the flesh on my arm so bad. And, you know, I of course didn't go to a hospital either. Like I went to the sites, I went to Moss Park, I went to Fred Victor, like, you know, and I had the nurses there, they helped me clean my wounds. And it was never like it was never like a judgment ever. Like it's just like, yeah, of course, come, like, and people were happy to see you, right? And it's just like I can't even go to Tim Hortons and like order a coffee or ask to use the bathroom, like, without getting some kind of a look, or you know. So, and all the overdoses that I had, like, and a part of my story too that I share, is I used to overdose so much that I would know the layout of the ICU rooms in each hospital. So I'd wake up, and just based on the layout of the ICU room, I knew, okay, like I'm at Mount Sinai, I'm at Toronto General. And then they would start coming, like, what happened? Oh no, this happened, like, you know. And, you know, like, and of course we'd always use the sites. We never really used alone. And like other people have mentioned too, is for the clean supplies, because if I didn't have clean water, I'll tell you right now, like, I think I'd used Gatorade, milk, whatever I had. Like, you know, that's how bad my addiction got, right? I didn't care. As long as I could shoot it up, like, then I was okay, right? And so having access to clean stuff and clean supplies was like huge. And not just like you can get one at a time, like I could use there, make sure that I'm not going to die. And because of course, like, nobody wants to die, but me personally, I got to a point where I didn't care if I did, right? Like that was just the risk I was willing to take, right? And yeah, and even just recently when I went back to visit Moss Park, I was like, I don't recall, because a lot of us don't recall how many times we've overdosed, right? Because in my head, I'm thinking that maybe like 5 or 6. Staff were like, yeah, no, maybe 5 or 6 like this month, but not over all the years, right? So to think back, like I wouldn't, like 100%, I wouldn't be here without having access to those sites. And God forbid, like anybody, like God forbid I ever picked up a drug again and I needed these supports, I'd be scared. Like I'd be like, like God forbid, like my daughter, like I would hope to God that my daughter, like my parents tell me all the time, and they speak to people, like they're so grateful, right? Because not also that they could call the sites and know where I was and at least know that I was alive still, they couldn't find me. And yeah, so I think I'll close it there. Today, I'll talk a little bit today quick. Now I went back to school. I went and got my addiction and mental health worker diploma. Now I work at a hospital downtown Toronto as a peer support worker. Going back to school in September at TMU for my bachelor's in social work. So, I kind of like so many, like the common thread here, like not like this wouldn't be possible without harm reduction and without having these sites. Like, because I'd be 100%, my funeral would have already happened a long time ago, and as we've been to so many funerals since of our friends and stuff. It's heartbreaking. But yeah, so now I'll stop talking.
Thank you for sharing that. I think, one of the things we don't get to talk a lot about, well, openly, is about pregnant people using drugs and pregnant people using supervised consumption sites. And there would always be these discussions and these tensions, like, do we actually let pregnant people use supervised consumption sites? And yes, absolutely we do. And pregnant people should use the sites. And at Moss Park, they also had access to midwives who would see people who use drugs. And at some of the other places like the Works, they would have access to like Toronto Public Health nurses and getting people onto, neonatal vitamins and like all the things that they needed, taking people to their appointments. These are things that we don't talk about. And we talk about supervised consumption site like you're just there to get supervised around your substance use. We talk about it like it's just overdose response, but it isn't. It's like so much more than that. And I also just wanted to mention about youth. We had a lot of conversation here where everyone spoke about when they started, how young they were. We have conservatives out there going off right now about young people using drugs and how sites, let minors in and how like they're just losing their shit about minors. And it's like people start early. I was a very young person when I started drugs early, like very young. That is a very common thread that a lot of people have. They're teenagers or they're even preteens. And we have to be really honest about the fact that we're not all living the same lives. We don't all get the same chances in life. We all don't grow up in the same ways. And for some of us, our exposure to drugs can be very early on. I was 11 when I tried drugs for my first time. That's a child. But that is a reality for a lot of people that they're young. And then also the kind of loss that they see, like people talked a lot about loss and how early on people experience loss, how you're supposed to deal with all of that. I think what's so upsetting about the current context is that we're crushing people who are already crushed. Why are we closing services for people that are already feeling this, like the crushingness of life and the crushingness in this society, and then we're crushing people even more. And so, thank you all for sharing that. I'm going to move into asking you some questions, and anyone can answer at any time. I really want us to have a dialogue. I think this conversation has been so important so far for people to understand. We've got people from, who have experiences in different ways. And I was part of Moss Park in the tent, so like for me, I know people, so I'm like extra proud of people and like love seeing everyone. And we're still going despite how much fucking loss we've all collectively experienced or we've experienced personally. Yeah, hard to see Moss Park also close as the place that we we fought so hard for, where we for people who don't know, Moss Park was tents in a park. We were there for a year before we got funding to go inside. It was a very big political wedge. We used it to like fight for everyone. We learned from people in Vancouver, from Sarah Blythe and Livingston and others. Sarah Blythe spent a lot of time talking to us out here in Toronto. We just went ahead and did it. And at that time, we had a few hundred deaths in Ontario. We weren't at the thousands. We weren't at, 2 years of over 5,000 people dying. At that time, we saw it as an emergency too. We know that overdose deaths are preventable. And it's shocking that those who are in emergencies planning and management and CMOHs, I know that there's, they're not all the same, but it's the silence is deadly. The silence is really deadly. We've been left to deal with these emergencies ourselves. So I guess one thing I wanted to ask this group is like, there's a lot of misinformation about supervised consumption services and how they support people. And we heard a lot from you already, how they supported you. And I guess I'm curious about how they support communities you live in, what else is important for people to know about SES, and what it's like right now since the closures, what's happening on the ground. I know we've shared some of this, but if there's anything else more that people want to share, I know Travis, maybe you want to share about the legal challenge, would be really cool for people to know, but really up to you guys.
Yeah, I could share on that. Like, I did file a lawsuit against the government to try and get an injunction to keep the sites open in Calgary and Lethbridge, and we're in the Court of Appeals now, which hopefully will be in court by the fall. As expected, it's going to be a long battle, but grateful to be a part of it. Definitely not giving up. And then yeah, the stigma about the supervised consumption sites are like, I think most of the community thinks that it's just some place to enable people to do drugs, and for me, that is 100% not the case. It's where I was loved, humanized, cared for, and was able to start having those conversations about the next step in my recovery, and what I can do to get my daughter back, and what I can do to reduce my drug use, so I can take the next steps possible, right? And especially one worker there, just he was just instrumental into where I am today. And I still am in contact with him, and just related to me, a man with daughters, a man with a soft heart, and we had a lot in common. And he didn't just look at me like some junkie trying to do drugs. He looked at me like a human, and a father, and someone in pain, and we talked together, and we cried together, and he helped change my perception about where I was at, and how I can change that, right? And with his help, I started to take those steps. I started to call detoxes and started to call treatment centers, and I think the conversation around what needs to happen is a conversation around housing, as well, alongside of this, because I'm very, very lucky that I had friend and family over the last year. So I've had housing, because it is impossible if you don't have housing to take those next steps, right? And I think we'll talk about that too in a little bit, but I'll pass it off here.
Yeah, definitely in Saskatoon, being the only safe consumption site in the city. I think we're actually the only one in the province, but that's what we were always called enablers. It was known as a place where all the dealers hang out, and we're just like allowing all this crime to happen. A lot of the blame was definitely put on us. Even after we closed, like there was at one point we were very understaffed. There was 3 of us responding to overdoses every single day. We never got a break. So what ended up happening, we all burnt out. We ended up closing the safe consumption site for, I think it was like a week. and the backlash that we got, like the city just came after us and they're like, how dare you? We need you. People are dying because of you. Like, you guys need to be out there saving lives. But then when we're open, like, they just totally flipped the script. Like, what are you doing? You're killing people, you're enabling. So, like, no support from the city, no support from the government, no support really from anyone except for the people who believe in harm reduction and who were educated about what we were actually doing. We also did a lot of other things, but yeah, definitely a lot of stigma around the safe consumption site in Saskatoon. And now that we're closed, same thing, people openly overdosing everywhere. It used to be kind of all in the core neighborhood, but now it's there, it's downtown, it's on the east side, in places where people usually would not see overdoses. My mom has responded to overdoses outside her building downtown. My brother responded to his first overdose. Like, it's just so many people who have never seen an overdose are responding to overdoses now. And like, I still go out, hand out as much naloxone and Narcan as I can, train people. The city now, since Prairie Harm has closed, is trying, because they had no choice, they're trying to handle the overdoses with, they got some new outreach teams, but how effective they are, and the community doesn't really trust them. They're new, they're working for the city. There's not a lot of trust in any of really the outreach teams that are out there now. But I myself started my own nonprofit organization with my coworker from Prairie Harm Reduction. And so we're just trying to fill that gap. We're out there doing what we did at Prairie Harm, feeding people, clothing people, caring for people. Same thing. If we don't see them for a couple days, we go looking for them. We're calling, we used to call the hospitals and the jails and find out, see if our people were there. But yeah, it's definitely been a huge loss to the community, and now the city is really, I think, probably regretting shutting us down. But it is what it is, and there's a lot of people working, doing outreach, and just, like, I don't have a job right now. I mean, I do have a job. It's not one that aligns with my values. So I'm doing outreach just because I feel like I need to. I feel like our people that access services have been abandoned in a way. Like, I feel like I've abandoned them. So just for them to see a familiar face and know that I still care, even though we're not open, is huge. Like, I just got told the other day that I'm saving lives simply by making sure people are okay, simply by making them feel like they're not alone. So I'm definitely going to continue doing what I'm doing. And I'm really interested in what Travis is doing with the government there. And I'm wondering if that's like something that I can do. And like, I know I can, but it's hard. It's really hard to fight the government here in Saskatchewan, for sure.
I mean, there are lawyers. I've noticed, I just looked to see who is participating, and there are some lawyers on here who maybe, if you want to be in touch with them or if they see you on here, could reach out to you, who are part of those legal challenges. Like here in Ontario, it's a bit challenging around the legal challenges because we couldn't get an organization that housed a supervised consumption site that was closing to be part of a legal challenge. They would not take on the government because they were afraid of the repercussions from the Ford government and about like the backlash or if they'd lose all their funding. For many of us, that's really hard to hear because we think drug users' lives are also important. And so we understand that like I'm just going to speak on behalf of like many people I organize with. We understand that organizations are afraid, but where does it stop and where does it end? Like you are going to lose your supervised consumption site, you're going to lose all these things. You have your staff now outside responding to overdoses, burning out, like you said, Ashley, like people burned out fast. It's traumatizing to find people black and like to find people blue, to find them gray, to find them stuck somewhere, to respond to that, to respond to dead people, which is what people respond to. And then to be like, well, there's nothing we can do. It's like, at least we put up a fight. And so it's been really, this government has been so awful. Like what they did was they pulled the funding. And so it's a bit of a harder challenge legally for us to challenge around funding pulling. It's not the same as like making a 200-meter rule, which, people are a part of those court cases, that there is a legal challenge around that, which will be good for like other provinces where the conservative governments are trying legal challenges or trying 200-meter rules or whatever, for the think of the children and the parks and the schools and all these things.
Yeah.
But we have not heard at all from the judge yet on that. We haven't heard anything. There was an injunction for some of the sites which has saved them, like K-MOPS, the WCA in Hamilton, which is the only gender-specific site in all of Canada, maybe even in the world. And then community health centers, they took funding, or other places took funding for these heart hubs, and the government said to them, one, you can't talk about what's going on with your funding or the heart hub. You can't have any harm reduction. You can't do safe supply. You can't do needle exchange. You can't do supervised consumption sites. So what do you have left? So these are organizations that existed for like 20 years doing this, like doing that work. Now don't do that work. And then like somewhere like the Works, for instance, which Ali talked about using, that was the busiest site in Toronto. It was extremely busy. It closed its doors. Like it's been over about a year and a half since it's closed its doors. They have not replicated any kind of services that would have really helped people in the same way. So they have a heart hub. But they got funding from the treatment emergency fund from the Canadian federal government. They have used that for capital expenses for their new building. Meanwhile, we have people overdosing, like out on the street, people who are dying, people who are not doing well, and and they're not going to be open with their heart hub until 2027. So that's not even for another year. Right now, their connections are to things that already existed, like detox. So here in Ontario, for instance, there is only one medical detox for the whole of the province, really, that people can go to, and it's at CAMH, and it has an 8-week waiting list, probably higher now. But what is detox? And so that's actually what question I wanted to ask you all is like, harm reductions being attacked. We have this dismantling, we have politicians, policymakers, we have this whole recovery-oriented systems of care in all three of our provinces are pushing for. They actually all work together, Alberta, Saskatchewan, Ontario, which is really good that we're having this conversation because I think people don't know how these are politically aligned. And they're pushing for building involuntary treatment centers, et cetera. And I was curious from all of your perspectives, what do you think of this? Like, how is this playing out where you live? I know in Calgary, there was a comment in the chat just about in Calgary how there was a quote by the Calgary police that said, arresting is connecting. And so I wondered what your perspectives are on this, all from all of you, like if anyone wants to comment on that.
So I just wanted to like comment first quickly about like how I think it's interesting that like the opposite side of, I guess, us and like politically like claim to have the same goals that we have, right? And that's keeping people alive, helping people in our community. And it seems that like kind of because I've had a lot of debates with people who completely disagree. And it just seems like that these politicians, like they want to seem like that, like they're helping and stuff like that. But consumption sites and harm reduction isn't attractive. And to the voters who, sorry, I apologize for my cat. For it's to the voters and stuff like that, it's one second. It's not attractive to be funding these things, but I mean, it's not attractive to those people who don't understand addiction. And I think that there's not enough education out there to people who aren't in it, I guess. And so, I mean, I guess what I'm trying to say is like there are the community members out there who aren't involved in this one-on-one see sites and see people using, and it brings fear. I mean, it's a scary thing if you don't understand it, but then fear brings anger, and then it is directed in a way that I think that maybe like it would be helpful if we could educate those people so that they understand that just treatment oriented like care and like doing just that and sending all your money to that is not going to help. It's just not. Sure, maybe for people who are lucky enough to have cell phones, internet, family, and support that they already know and connect with regularly can get them there. But the majority of the people that I know that are in my community don't have that. And so when we close, now they're gone, they're hiding. And the thing is when we opened up, we were starting to build such a strong connection with people who use drugs. I mean, how long has it been that drug users have been treated like shit? You know what I mean? Treated like absolute shit. And so we come in, we're using harm reduction, we care, and it took a long time to build this relationship where they trusted us. But we were getting there, and that's the thing, we were getting there, and for them to actually trust that we were genuinely there to help, not call the cops, not try and fix their problem, not send them to treatment, and have these wraparound services. That was a big deal. But now that we're gone, I mean, if it does, like I think Ashley said, like I think maybe they feel like we've let them down, and that's how I feel. And so having that, now they're separated, they're not talking, they don't trust anymore, they're hiding. And so to get them to treatment, sure, treatment's a great idea, and I think it's a part of the puzzle, but it's a fraction. And this is a well-rounded issue, just like addiction. I mean, you can't just stop using drugs and be better. I mean, there's all these other aspects. It's well-rounded that you got to fix all aspects of your life, and it's the same with getting helping our community, you know what I mean? So
Yeah, I'll add on to that. That was very well said. So replacing harm reduction basically with forced treatment, right? And I think, don't quote me on this, but I believe like before they open up the actual building, they're going to be using hospital space, right? So that doesn't make any sense at all. I'm definitely not anti-treatment at all. I've been to detox, I've been to treatment, but when you're unhoused with no cell phone and no way to call there every day for 3 months, it's like impossible to get there. Like treatment isn't a I'm going to go tomorrow kind of thing. It's like you got to go to detox and then you have to stay sober for 2 months, and you have to call there every single day or you're automatically put to the bottom of the list. There's no wiggle room. So now with forced treatment, like who's regulating this? What are they teaching? What are they doing in there? And then on top of that, like what are they doing after? So the people that are getting locked in there for 90 days, now they're getting released, not wanting to quit. And so they're the most high risk for overdose that they're ever going to be, especially after the fact that they got forced into there for 90 days. They're like, maybe they didn't want to quit doing drugs. You know what I mean? Now they're locked up for 90 days against their will, and they're probably going to overdose. We're going to see way more deaths. We're going to see it's and then to take up hospital space on top of that doesn't make any sense at all. Our hospitals are already overloaded and overwhelmed. So now lock people in there with substance abuse disorder. It's just that's medical trauma. It's kidnapping. It's not okay.
Thanks for sharing that. I see Ali, you have your hand up.
I was just gonna say, because as somebody who's I've been to treatment 3 times, and that's not even including the detoxes. It's like I'm very, very grateful that I have parents who were able to, like, when I called and said I was ready, like they plucked me in and put me in like the next day, right? The cost of what that was each time, people don't have that. Like most people don't, like even just regular folks, they just don't have access to that. It's very unlikely. So I understand that, but even when we were trying to get, do you mind if I like?
Absolutely.
So like when we were trying to get John into treatment, right? Like it was just kind of piggybacking on like what Sam and Travis said, like call us every day. And like, again, he had his mom there. So he was, how are you supposed to do that on the street? Like you can't, like, I mean, it's just so unrealistic. And, you know, I think, and this might be an idea, but it'd be pretty cool if we did like a day in the life, like a walk in the life for like a couple of days with different people, like, and get like these politicians, because they'll see how many barriers there were. So like, okay, no problem. I want to go to treatment now, right? And so let's call. Okay, well, there's no beds. Okay, so then say you get a bed. Okay, then 10 days later, I have nowhere to go. Where am I going? There's no treatment beds now, right? Okay, now I get into treatment and I finished 30 days or whatever. Say I made it through the first 3 huge barriers, and now I've gone to treatment. I did my 28, 30 days, whatever the case may be, and now I have nowhere to live. Like I'm still on the street. So now what? Right? Like it's just like it's just so unrealistic, this whole process, right? Like, you know, like I wouldn't have been able to get sober without being housed first. Like I got housed and then I didn't get like sober right away, but again, I had to come to the realization on my own, like I can't do this anymore. Like I really just can't. But had I not, like, how do people go to treatment and then come out and just have nothing? Like, you know, it's like, as Sam was saying, like, it's just like a very small fraction. And also too, exactly, like what kind of curriculum is it? Is it a harm reduction approach? Is it a 12-step approach? Like, is it like, there's so many people. And for me, like I wanted to go to treatment all 3 times and I still didn't get it the first time. So how is it going to be that people are going to be forced to go? It's just not how it works, right? Because if that's how it works, people would go to jail and come out and not go back. Like, do you know what I mean? Like it's just so unrealistic.
Well, there's also just like limited beds, and then also the programs that people get sent to are just the same at almost every single place. So it's not like there is an extension, and like especially in the public system. Like I only know Ontario well, so sorry for everyone else, but you know, we are a huge province and we have about 1,000 publicly accessible beds for people, and about 300 of those are just for women. So you think about, and then if you go to a program, it's not necessary, they're all kind of the same. So, you know, I think people not only need that day in the life alley, but they also need to go and sit in a treatment center, not have access to their phone, have to pray before their meal, have to like go to a group, have to be in groups all day. I think they need to also experience what it's actually like. We're talking about a system that is built off a model that was created in the 1950s that hasn't really shifted and changed to meet the needs. And we're not even talking about like being honoring of people's spiritual beliefs or their own identities, or that they are actually like places that offer the kinds of care people might need. Like now we're in this crisis for a decade. How many of these places offer people grief support or deal with people's trauma from all this loss? They don't. That does not exist in the majority of these places. So, you know, this is another one we could do. I think we should have a talk about is when we're talking about involuntary treatment, that we already have a system that is so like inaccessible and not expansive, and doesn't meet people's needs and doesn't have to show their outcomes. It's very hard to find, as someone who does research in this area, it's very hard to find outcome data of any of these places. Residential treatment doesn't fall under the Canada Health Act because it wasn't seen as a healthcare service. So that in itself, and I think we need to talk about privatization. I see the destruction of supervised consumption sites as a push to privatization as well. Lots of money to be made in private treatment. Okay, we have 5 minutes left. Sorry to go off about that, but I'm just like, we need to talk about this because, you know, people have already experienced what it's like to go voluntarily. So why don't we talk about like the system voluntarily? And maybe we could do that in another webinar, of what people's experiences are actually like, because I think people need to know how fucking hard it is to get into a place, to find a place that you like. And Ashley, you have your hand up and please go for it. And then we'll do yeah.
I just wanted to say about the privatization and the treatment centers, like they are exploiting people who use drugs. They're not there to truly, I mean, they want to look good and like they're doing the right thing, but they just want money. And especially when they don't have to show their outcomes, that that's crazy to me. Like, especially after working in an SES, we had to show every single thing, everything we gave out, everything we got in, everybody who's coming in, you know. So it's it's gross to me,
Yeah,
honestly.
it's very insidious, and I think we need to talk about it, you know. And then when people get kicked out, they don't have an SES to go to, so when they get discharged, they don't have a place that's going to support them. And it would be great to have that conversation. Okay, we have 4 minutes left. This has been like we could probably talk forever. And I'm really freaking grateful that we've had this conversation today and that all of you have been so open to talk about your experiences. And so I just wanted to leave the last 4 minutes to you. I don't know if we have Q&A. I saw one about community um and so there's a question also, Ashley, if you wanted to answer about what your peer support is. I think many people are going back to the days that we were before. Like we got to create mutual aid networks. We got to take people from being reliant on the state to not being reliant on the state because people are being abandoned to die. And so Ash, if you want to answer that, that'd be great. And then if we could just close out, if everyone wants to say something for a minute, that would be awesome. Because we're getting up on time. Sorry, I'm
Okay,
rattling.
so my organization is called Reach Saskatoon. We're doing it out of my vehicle right now. We are a needle exchange, naloxone training site. We're working with a lot of the other community supports. We have so much support from everyone who knows us. And people are so happy to see us out there. But yeah, we're just right now, we're starting out in a vehicle, doing what we can. You know, Aid Saskatoon started out of a van and grew into this huge organization. So that's the goal, to eventually have a building. An SCS would be amazing. Right now, we want to work on getting the drug testing machine, so that we can test substances, put out drug alerts. Yeah, right now it's just two of us, me and my coworker. We have zero funds, so we're just
How do
we're
we get
working.
you money, Ashley? How do people get you money? Do you guys have a fundraiser? Can you put it in the
Um,
chat?
yeah, I will put the email in the chat
Okay.
and open to e-transfers.
Sick. That's how we do it, right? Like
Yeah.
Moss Park, the first site in Ontario, the first OPS, that was funded by community. We received almost $200,000 from community to run for a year. So, you know, if we hadn't had people donating, we couldn't have done it. It wouldn't have been, you know, we were never intended to have a site in the downtown east. We ended up with many. And so, you know, people often could donate, you know. So I would donate to grassroots initiatives for sure. So Ashley, please put your email. Okay, it's in there. It's reachsaskatoon@gmail.com. If you have
Yep.
any funds to spare, please send them to grassroots organizing. That's what we got to do. Okay, Sam, Travis, Ali, any final words?
I just want to thank you for the time and space to share all of our stories and yeah, hopefully there's more opportunities in the future to try and have a positive impact. Grateful. Thank you.
Mhm.
Yeah, thank you so much for having me. I just want to say that taking the SCS for my community was like taking a hospital from a community. It really was, and you can't you can't recover if you're dead. So yeah, thank you.
Dead people do not recover. Yep.
You know, I just want to say too, like, thank you for like to everyone on here for like just creating, because like even as like we're speaking, like I'm watching the comments and like it's just thank you for making this a safe space to make us comfortable to be able to be so vulnerable, right?
Yeah.
So yeah, I really appreciate that.
Yeah, I want to thank everybody that for getting vulnerable with their stories and stuff. And yeah, what the SCS sites really meant to us is and what it means for people in the future. It's just a way of life right now, and we gotta get around.
Well, you know, things flip one way and then they flip the next. And I really truly believe we're gonna come out of this and that we should be dreaming and thinking of all the things that we actually need and continue to fight for those. If it's ending the drug war, safer supply, just because people are against it doesn't mean that we have to cave to those. We felt this before during the Harper years. We felt this before always, right? Like people have always struggled with oppression. Harm reduction is also about, you know, breaking those chains of oppression. It's about liberation for all people, especially people who use drugs. I think that's the part that scares those in decision making roles because they know that we have community power, we take care of each other, and that we always will, and we still will. We're not going to let each other down. So I know that's a big feeling that people have. I feel that too. Like, you know, there's a lot of survivor's guilt of losing your friends and your friend circles, and then there's and family, and then there's also like the ways that we feel now, like just watching things that we all worked so hard to build be taken away. But that doesn't mean we stop. You guys are living legends, and we're here to like continue that fight together. And I'm just so grateful to have been able to do this with you today, and for Rebecca for hosting and Reclaim for moderating the chat. And let's do more of this. I think people really need to hear from you, from this expertise. It's like really amazing. So thank you. Thank you so much.
And big thanks to you too, Zoe, for making this all happen for us. The panelists, you guys are all amazing, and I would love more conversations like this for us to do together. And I'm also really grateful for all the people who showed up today, who took time out of their day to be here to support these stories being shared and told. I will send out an email to all the registrants with information, the fantastic resources, including the fundraising resources, so we can support people. So stay tuned for that email. Our group here are going to have a little debrief chat after we say goodbye to you, and we'll see if we're good for posting this video to share with others, and I'll let you know about that as well. Thanks, everyone. If anybody needs to debrief or is looking for someone to chat with, send us an email. I'll put my email again in the chat, and we can connect. Yeah, this has been really heavy and also really inspiring. Thank you. And I'm going to turn us off with that. Thanks, everyone. Take good care of yourselves and each other.
And we just have